Welcome to Lesson 2. Now I just wanted to cover some of the more common terminology and acronyms used in medical billing and coding before we moved on to some of the other topics. The adjudication process refers to the processing and settlement of claims by the insurance payer per their rules and guidelines. That's once the claim reaches the payer and is accepted by the payer. Appeal process, that's the process of objecting to an insurance payer's decision to deny or reduce payment. Assignment of benefits are the insurance payments to a healthcare provider on behalf of the patient for their treatment. Beneficiary, that's the person covered by the health insurance plan that is receiving the benefits. A clearinghouse is a service that transmits a batch of claims to each individual carrier after checking for claim errors. Copay, that's the amount paid by a patient at each visit per their contract with the insurance plan. Coinsurance, that's the percentage or amount defined in the insurance plan for which the patient is responsible. This may be expressed in terms of percentages like 90-10 or 80-20. Well, that lower percentage is the patient responsibility. Coordination of benefits, sometimes abbreviated as COB. That's the coordination of the insurance coverage when a patient is covered by more than one insurance plan. You need to determine which is primary insurance and which is secondary insurance, and there are rules for determining that we get into in the fundamentals course in more detail. Credentialing, that's the application process for a provider to participate in an insurance carrier's plan or program to be a network provider. A crossover claim is when a claim is processed by the primary insurance carrier and then sent electronically directly to the secondary insurance payer. The CMS 1500, that is the primary form used to submit medical claims, and it's established by the CMS, Centers for Medicare and Medicaid Services, to submit claims to insurance payers. Day sheet, that's a daily summary of patient treatments, charges, and payments for a physician's office. Deductible, that's the amount the patient must pay before the insurance coverage kicks in. Continuation of the terminology. The fee schedule, this refers to a schedule of all the treatment codes that a physician uses and the cost associated with those. A guarantor, that is the responsible party and or the insured party who is not the patient. The inpatient refers to a hospital stay of more than 24 hours. Insured is the person through which the health insurance policy is issued. A modifier is a modifier to a CPT treatment code that provides additional information on any modifications made to that treatment code. Medical necessity, you'll see this term used a lot, and that's the determination of whether a service or procedure that was performed is medically necessary or determined to be medically necessary by an insurance payer. Medicare, that is the insurance provided by the federal government for people over 65 and those with certain other restrictions like kidney failure conditions. And Medicaid is the insurance coverage for low-income patients provided by the federal government. A few more important terms. Payer, you'll hear me refer to payer many times. That really just refers to the health insurance payer, not necessarily the patient payer. The practice management software is also referred to as the medical billing software, but it's used to create electronic claims and manage patient accounts and also schedule patient appointments. A provider is the physician or the medical care facility who provides healthcare services. Privacy rule, that's in reference to the HIPAA privacy standards, and we'll define HIPAA in just a minute here. Security standard is in reference to the HIPAA policies regarding safeguard of protected health information, or PHI. Superbill, this is the customized form that the provider uses to document treatment for diagnosis and treatment codes for a patient visit. TRICARE, that's the federal health insurance for active duty military personnel and their families. Acronyms and abbreviations, these are some of the more popular and common acronyms used in medical billing. The AMA is the American Medical Association. VCBS is Blue Cross Blue Shield. CMS is short for the Centers for Medicare and Medicaid Services. And you'll see CMS in a lot of forms, such as the CMS 1500 or the CMS 1450. CPT is short for Current Procedural Technology. This is the 5-digit code assigned to procedures that are performed by the physician. DME is short for Durable Medical Equipment. DOS is Date of Service. DX is an abbreviation for Diagnosis Codes. EMR is Electronic Medical Records. You'll also see EHR used, which is Electronic Health Records. EOB is the Explanation of Benefits. ERA is for Electronic Remittance Advice. And E&M, you'll see that very commonly. That refers to the Evaluation and Management section of the CPT codes. CPT codes are organized in several sections. HCPCS, that's abbreviated as HCPCS, and that stands for the Healthcare Financing Administration Common Procedure Coding System. HIPAA, you'll see that used a lot in reference to patient privacy and security. That refers to the Health Insurance Portability and Accountability Act that was passed back in 1996 and has a tremendous impact on billing and coding and healthcare reimbursement in general. ICD is the International Classification of Diseases. NOS stands for Not Otherwise Specified. NPI is the National Provider Identifier Number. PHI is short for Protected Health Information. POS, Place of Service. RVU is Relative Value Units. And SOF is an abbreviation for Signature on File that you commonly see on these CMS 1500 forms. So I just briefly wanted to go over some of the more common terms and acronyms used in medical billing. These are drawn out of our Medical Billing Terms Dictionary, which is included in our Fundamentals course. It's a more comprehensive and complete dictionary that defines all these terms and acronyms. Just wanted to introduce you to those so that when we get into the following lessons, you'll understand what these mean and stand for.